A successful full recovery from pancreatic cancer is possible, and living without a pancreas offers a great option, as you will see with the real-life experience of Lana Brandt, which will be described shortly. However, you would need to make provisions to compensate for the two major roles of the pancreas, to keep blood sugar within range and to assist with food digestion. In this video, let's highlight 10 warning symptoms of pancreatic cancer and how to manage it. Important notice. Kindly note that all information presented on this channel is based on thorough and relevant scientific research conducted by a medical professional. First, here is a real-life experience of Lana Brandt, a woman with a strong family history of pancreatic cancer. After dealing with multiple episodes of inflamed pancreas, she discovered she carried a genetic disposition that put her at higher risk for the disease. To stay ahead of it, experts at Johns Hopkins took proactive steps. They removed her pancreas and spleen using a minimally invasive procedure. But here's the amazing part. They helped her body keep producing insulin even after the surgery. Lana's story is a great example of how early detection of pancreatic disease can improve survival rates. Numerous challenges arise in the diagnosis and treatment of pancreatic cancer, including a lack of specific symptoms, making early diagnosis difficult. Approximately 50% of pancreatic cancers are not identified until they have already spread to other parts of the body. Healthcare providers cannot feel the pancreas during routine exams. Pancreatic tumors are difficult to detect on routine imaging tests. Pancreatic cancer is resistant to many common cancer drugs. As a result of these limitations, pancreatic cancer survival rates remain low. Common symptoms of pancreatic cancer. 1. Stomach and back pain. Symptoms typically emerge once the tumor starts impacting other organs in the digestive system. Pancreatic cancer can be very painful because it may involve nearby nerves. A common complaint from pancreatic cancer patients is a dull pain in the upper part of the belly and the middle or upper back that comes and goes. This pain is likely caused by the tumor pressing on the spine. This pain can worsen when lying down, but may be relieved by leaning forward. Unfortunately, this pain often appears too late as a warning symptom, typically when the cancer has already spread to nearby tissues. Pain associated with pancreatic cancer varies from person to person, and some may experience no pain at all. Always keep your doctor informed to determine the best way to manage this pain. 2. Jaundice. Pancreatic cancer is the fourth most common cause of cancer-related deaths in the U.S., while many symptoms of pancreatic cancer are initially attributed to other conditions. Jaundice, yellowing of the skin and eyes, is often a sign of a problem with the pancreas. The pancreas is a gland in your abdomen, located between your spine and stomach. It produces hormones that regulate blood sugar levels and enzymes that aid in digestion. The main pancreatic duct connects the pancreas to the bile duct. Most pancreatic cancers begin in the ducts of the pancreas. Jaundice occurs when a tumor in the head of the pancreas blocks the bile duct, a tube that carries bile into the small intestine. Since bile contains a lot of yellow pigment, this blockage causes the skin and eyes to turn yellow. 3. Dark urine. When the bile duct is blocked, bile enters the bloodstream instead of being excreted through the bowel. This excess bile is then passed in the urine, causing it to appear darker than usual. 4. Pale stools. The absence of pancreatic juice and bile, pigments in the digestive tract, can result in improperly formed stools that are pale in color. 5. Greasy stools. If the pancreatic duct is blocked, a symptom called steatorrhea would develop. This refers to fatty stools. You may pass frequent large bowel movements that are pale, smelly, and difficult to flush because they float in water. These bowel changes indicate that your body is not absorbing food properly, which can also lead to weight loss. 6. Sick feelings. You may feel unwell generally due to jaundice or an inflamed pancreas compressing neighboring organs such as the spleen, stomach, or gallbladder. Both conditions disrupt the body's delicate chemical balance. Additionally, you might feel sick if the cancer, or the inflammation around it, blocks food from passing out of the stomach and into the first part of the bowel. 7. Change in bowel habits. Due to the sick feelings, you might experience a range of digestive difficulties, such as loss of appetite, indigestion, nausea, vomiting, swelling in the abdomen, bloating. 8. Sudden-onset diabetes. Pancreatic cancer may trigger sudden-onset diabetes without an obvious cause. It can destroy the cells that produce insulin, causing blood sugar levels to rise. If a patient has a new and unexplained diabetes diagnosis, pancreatic cancer should be considered and ruled out as a possible cause. 9. Weight loss. Unintentional, significant, and unexplained weight loss is often a sign that something is wrong in the body. Weight loss is one of the most common symptoms of pancreatic cancer. 10. Blood clots. In some cases, pancreatic cancer is linked to blood clots. These clots may form in the deep and smaller veins of the body, usually in the leg. Sometimes the clots may disappear and then develop elsewhere in the body. Symptoms include pain, redness, and swelling in the area where the clot has formed. These 10 symptoms of pancreatic cancer we have discussed can be life-threatening. So, take prompt action. After highlighting these 10 common symptoms of pancreatic cancer, you may wonder if the symptoms differ when the cancer is in its advanced stages. Metastatic pancreatic cancer is the advanced stage of pancreatic cancer that occurs when cancer that starts in the pancreas spreads to another part of the body, such as the liver, nearby lymph nodes, stomach, lungs, or bones. The most common site for pancreatic cancer to spread is the liver. In these cases, symptoms vary depending on the organs affected. Current trends suggest that pancreatic cancer will become the second leading cause of cancer-related deaths in the United States by 2030. With no established preventative strategy for pancreatic cancer, you may wonder, how can I lower my chances of developing pancreatic cancer? Let's explore the factors that increase the risk of developing pancreatic cancer and how to avoid them. Risk factors for pancreatic cancer. 1. Smoking. Cigarette smoking is the leading risk factor for pancreatic cancer. Studies show that tobacco smoking gives cancer cells the ability to spread to other organs, while nicotine stimulates tumor growth, making cancer cells more resistant to treatment. Additionally, smoking decreases a patient's survival rate as tobacco directly and negatively interferes with chemotherapy. Here's the bad news. Using cigars, pipes, and smokeless tobacco products also increases your risk of pancreatic cancer. And the good news is, 5 years after quitting smoking, the harmful effects related to pancreatic cancer risk are eliminated from your body. 2. Family history. The American Cancer Society reports that up to 10% of pancreatic cancers are caused by inherited gene alterations passed from parent to child. The experience shared at the beginning of this video is evidence that pancreatic cancer can be genetic. If you have a strong family history of pancreatic cancer, you should contact a genetic counseling and screening program. 3. Age. The risk of developing pancreatic cancer increases with age. Studies show a reduced risk for individuals under 40 years old, with most pancreatic cancer diagnoses occurring between the ages of 60 and 80. 4. Alcohol consumption. Research has found that drunkenness is associated with inflammation of the pancreas. All alcoholic beverages have cancer-inducing ability when consumed in excess, and it is advised to drink in moderation. When alcohol consumption is combined with smoking, there is a threefold increase in gene alterations. Prolonged inflammation of the pancreas can release growth factors and toxins, leading to genetic damage and uncontrolled growth of pancreatic cells, potentially resulting in pancreatic cancer. The wise course of action is to maintain a balanced approach when drinking alcohol. 5. Obesity. Obese individuals are often diagnosed with pancreatic cancer 1 year earlier than the average population. Obesity increases the risk of mortality not only from pancreatic cancer, but also from other cancers. A higher body mass index, BMI, is associated with reduced physical activity, which can lead to more frequent inflammation and hormonal disruptions, increasing the risk of carcinogen exposure. Movement is life. Stay active to keep cancer away. 6. Diet. Health experts recommend avoiding high-calorie soft drinks to promote a healthy lifestyle and reduce the risk of diseases such as obesity and diabetes. Eating excessive amounts of red and processed meats may increase the risk of pancreatic cancer. Instead, focus on eating fresh fruits, vegetables, and whole grains. Additionally, limit exposure to harmful chemicals such as asbestos, pesticides, and petrochemicals, as they can increase cancer risk. Let's talk briefly about diagnosis of pancreatic cancer. There are currently no single tests for pancreatic cancer. Most cases are discovered when symptoms develop or during imaging studies, such as a CT or MRI scan, performed for other reasons. A pancreas blood test can detect tumor markers, which are substances that may indicate the presence of cancer. Treatment options for pancreatic cancer depend on several factors, including the exact location of the tumor, the stage of the cancer, your overall health, whether the cancer has spread beyond the pancreas. Treatment options typically include surgery, chemotherapy, and radiation therapy. In conclusion, while pancreatic cancer remains one of the most challenging cancers to detect and treat, hope is not lost. Early detection, as seen in Lana Brandt's inspiring story, can greatly improve outcomes. Understanding the warning signs, such as stomach pain, jaundice, and sudden-onset diabetes, alongside risk factors like smoking, obesity, and family history, is critical in taking proactive steps. Leading a healthy lifestyle, quitting smoking, maintaining a balanced diet, staying active, and moderating alcohol intake can lower your risk of developing this disease. Remember, knowledge and action are your strongest factors in the fight against pancreatic cancer. Stay informed and consult with your doctor if you experience any concerning symptoms. Don't forget to subscribe for more videos like this and give us a thumbs up if you found this video worthwhile.